When we consider prebiotics and gut integrity, as I mentioned, there are many roles when we think about immunity and inflammation that are going to support the integrity of the GI tract. And as we know, the colon is the barrier between the potential pathogens and the sterile environment. The colon is actually the site where we find the majority of the bacteria, whether it's the good or the bad bacteria. And so the prebiotics actually help to promote the ileal and colonic cell proliferation. Again, we want to make sure we have lots of cells and that they're nice and strong and that we have good villus height so we can maximize absorption, because this can ultimately help with intestinal healing and again the effect that it has with motility. And this whole effort, when you control or help to provide a positive effect with gut integrity, you can minimize bacterial translocation, which, as we know, can lead to sepsis, which is when we have bacterial that is traveled through the lymphatic system systemically throughout the entire body, which can eventually lead to multiple organ failure and then ultimately death. So again, prebiotics certainly can have a huge potential on maintaining the integrity of the GI tract. And one of the clinical tools that may assist you is the Peptamen with Prebio Sales Aid. And that's a nice piece that you can talk of with your customer. Another area with prebiotics would include that patient population with IBD. And of course, with IBD, you have decreased barrier function, you have an increase in the mucosal permeability. So you may have a very thin layer of mucosa, so it makes it easier for the bacteria, especially the detrimental bacteria, to actually pass through and eventually end up in systemic circulation. You also have the opportunity for translocation of endotoxins and antigens. So again, these foreign compounds that trigger that whole inflammatory response. And ultimately, an individual with IBD is already in a more pro-inflammatory response. So the last thing that we want to do is continue to rev that up. So the role of prebiotics, we can actually help to restore the intestinal barrier. We can increase that bowel thickness, increase the mucin production, and make it a much thicker mucosa area to make it more difficult for the detrimental bacteria to translocate. We can also help to preserve the intestinal epithelium by the role of those inflammatory mediators. So those particular cytokines, whether they're pro-inflammatory or anti-inflammatory, to assist the individual with IBD. Again, they're already in a much more inflammatory state. So if we can somehow bring that back to a balance, that certainly could be another advantage for the use of prebiotics for the individual with IBD. Another area with prebiotics is the role that it has with recurring C. diff or C. difficile. And of course, the pathology here is that we have issues with bacterial invasion, and it's the toxins, not the actual bacteria, that cause the diarrhea. So once you have an overgrowth of C. diff, what happens over time is this bacteria releases various toxins, and it's these toxins that actually cause the diarrhea. And obviously, from a clinical standpoint, we hear this come up quite a bit because the staff, especially nursing, are getting tired of having to clean up these patients, not to mention the quality of life for these patients. And it unfortunately becomes a recurring problem and challenge in a closed environment. So in other words, a long-term care facility or hospital where you've got many patients where this bacteria can spread easily from one to another. Now, the role of prebiotics can help by certainly decreasing the pH, as I've mentioned several times, to make it much more unfavorable for the C. diff to survive and continue to proliferate and cause bacterial overgrowth. And of course, if we can support the proliferation of the good or the bifidogenic bacteria, then we have the opportunity for an increase in competition to adhere to the mucosa. So in other words, the more bifidogenic bacteria, the goal is that they're going to take up the space along the mucosa, and the C. diff or the more detrimental bacteria are going to have a much more difficult time trying to find a place, if you will, along the colon to basically adhere and then eventually possibly translocate and get past the brush border and into circulation. We also see the role of prebiotics being beneficial with C. diff or minimizing C. diff because it enhances the motility by increasing bacterial biomass. So again, moving things through. The longer that these detrimental bacteria hang out in the colon, if you will, the increased opportunity they have to try and adhere to the mucosa. And ultimately, we want to enhance the resistance to colonization. So again, you want to overproduce, if you will, or stimulate the growth of the good bacteria and make it much more detrimental or difficult for these pathogenic bacteria to adhere to the mucosa. So what are some potential health benefits as far as emerging science today? Well, a couple of studies have looked at, including animal studies and human studies, have looked at the role of improving mineral absorption. And more specifically, the data seems stronger and stronger with the role with calcium. And what we've seen with providing prebiotics, because it does lower the pH and make it a more acidic environment, it actually enhances the solubility of calcium and therefore makes it more readily available or to be able to be absorbed. And a question I get oftentimes is, I didn't realize we could absorb calcium in the colon. But actually, you can absorb calcium through the entire length of the intestinal tract, including the colon. And that's because there's an actual second transport mechanism. It's actually considered to be a passive and independent transport mechanism of vitamin D. So again, we can absorb calcium throughout the entire length of the intestine. And another reason why they're focusing on teenage girls especially is the fact that we find in today's surveys, most of the teenage girls are not getting enough calcium in their diet to begin with. So this is a new area that's being researched as far as potential benefits of using prebiotics to help increase or enhance the absorption of calcium. In regards to prebiotics with tube feedings, because obviously that's an area that we want to focus on as well, certainly there might be questions that clinicians might ask you, and one of them might be the issue with clogging the tube. Whenever clinicians think about fiber, they think about increasing the viscosity of the formula, and then of course, ultimately, is this going to clog the tube and make more problems? Well, one of the benefits or advantages of prebiotics is, yes, they are soluble fibers, which tend to be very viscous. However, these pure prebiotics, FOS and or inulin, actually, being that they are water soluble, however, they do not contribute to the viscosity of the formula. So it's a great advantage to use them to provide these many potential benefits without increasing the viscosity of the formula. So it would not be due to the addition of a Prebio 1 to a formula that would cause a tube to clog. Also, another question that comes up with prebiotics and tube feeding is, am I going to have to be concerned with any drug interactions? And as I mentioned earlier, when it comes to interactions with drugs, basically it's the insoluble fibers that have known to interact with some of the nutrients, but not soluble fibers, and specifically there have been no reports of any drug interactions with the use of these particular prebiotics. But one of the good questions that we do get, and it does happen, is the complaint with flatulence or bloating or some type of abdominal pain. And what the literature has shown with the various reports using these pure prebiotics is that typically noticeable side effects begin to appear between 15 and greater than 20 grams per day. So a lot of this too is dose dependent, and there's also the influence of chain length. And what that means basically is you don't want to give a huge amount. You wouldn't want to give all 20 grams at one time. And obviously with the tube feeding, it's something that's throughout meals, whether it's an intermittent feeding or a gravity feeding or pump assisted feeding, it's given throughout a long period of time. As far as dose dependency, again, this is something that you wouldn't want to give all at one time, so you'd spread it out. And the influence of chain length, actually, that's another advantage of having our Prebio 1 blend, because again, FOS supporting more of the proximal area of the colon and inulin supporting more of the distal area of the colon to maximize that coverage benefit, but it also breaks down the fermentation as far as FOS being more quickly fermented, inulin taking longer. So it kind of breaks up so you don't have all of this particular one prebiotic, for example, Ross, that may just use FOS that's going to be really quickly fermented within the proximal area of the colon that could potentially cause more undesirable side effects such as bloating or some abdominal pain. So again, another advantage of the Prebio 1 in a way for Nestle to differentiate ourselves from the competition.